Cytogenetics is the branch of genetics that studies cellular, structure and function as it relates to heredity, genetics. A microdeletion involves the removal or acquired absence of one or more nucleotides from a gene or chromosome. Tissue culture for non-neoplastic disorders, lymphocyte. A peripheral blood specimen is obtained by venipuncture. The blood is separated into its cellular constituents and the white blood cells are extracted. The white blood cells are placed in a tissue culture medium. White blood cells, specifically T lymphocytes, are stimulated with phytohemagglutinin, Phe, and grown in the tissue culture. Tissue culture for non-neoplastic disorders, skin or other solid tissue biopsy. Skin cells may be obtained by buccal smear or separately reportable biopsy. Solid tissue specimen requires separately reportable biopsy. Skin or other solid tissue cells are placed in a tissue culture medium. The cells are stimulated and grown in the tissue culture. Tissue culture for non-neoplastic disorders, amniotic fluid or chorionic villus cells. A separately reportable amniocentesis or chorionic villus sampling is performed. Culture and growth of an adequate number of fetal cells for analysis may require 2 to 3 weeks. Tissue culture for neoplastic disorders, bone marrow, blood cells. Bone marrow is obtained by separately reportable biopsy. Blood specimen is whole blood. The marrow and blood cells may be separated by cell type. The cells are placed in a tissue culture medium, which stimulates cell growth. Tissue culture for neoplastic disorders, solid tumor. Cell culture prepared from a biopsied or resected solid tumor. The cells are placed in a tissue culture medium, which stimulates cell growth. Cryopreservation, freezing and storage of cells, each cell line. Cryopreservation is a technique of freezing and maintaining cells at extremely low temperatures to preserve the genetic and metabolic properties of the cell. Cryopreservation is performed to allow storage of cells for subsequent culture and analysis at a reference laboratory. Report this code for each cell line. A cell line is considered one that holds the potential for indefinite subculture in a lab setting. Thawing and expansion of frozen cells, each aliquot. Cells frozen by cryopreservation are thawed and expanded, amplified, for study. Report each aliquot separately. An aliquot refers to the equal division of a sample of a substance, with each part related quantitatively to each other and to the sample as a whole. Chromosome analysis for breakage syndromes, baseline sister chromatid exchange, SCE, 20 to 25 cells. This analysis is specifically for chromosome breakage syndromes, which are characterized by an increased rate of SCE during cell division where exact duplication of the genetic information in each chromatid fails to occur. Instead, genetic information is rearranged between the sister chromatids during cell division. This test would normally use more traditional techniques, such as direct microscopic analysis of cells arrested in metaphase. Chromosome analysis for breakage syndromes, baseline breakage, score 50 to 100 cells, count 20 cells, 2 karyotypes, e.g., for ataxia telangiectasia, Fanconi anemia, Fragile X. The procedure includes collecting 50 to 100 cells, counting 20, and performing 2 karyotypes. A karyotype is a visual exam of each chromosome pair from cells arrested in metaphase. Chromosome analysis for breakage syndromes, score 100 cells, classed Ogen stress, e.g., diaposibutane, mitomycin C, ionizing radiation, UV radiation. The location of the fragile site is used to diagnose the specific breakage syndrome. The code includes the scoring of 100 cells. Chromosome analysis, count 5 cells, 1 karyotype, with bending. 88,262 count 15 to 20 cells, 2 karyotypes, with bending. 88,263 count 45 cells for mosaicism, 2 karyotypes, with bending. 88,264 analyze 20 to 25 cells. Karyotype is the full chromosome set that genetically defines an individual. Banding refers to the appearance of stripes on stained paired bundles of chromosomes. This test would normally use more traditional techniques, such as direct microscopic analysis of cells arrested in metaphase. Mosaicism refers to alterations in chromosomes that do not affect every somatic, non-sex cell, chromosome, but are manifested during embryonic development. The individual is said to have 2 or more cell lines of different genetic or chromosomal makeup. Chromosome analysis, amniotic fluid or chorionic villus, count 15 cells, 1 karyotype, with bending. This test would normally use more traditional techniques, such as direct microscopic analysis of cells arrested in metaphase with GIMSA or quinacrine banding techniques. Chromosome analysis, in situ for amniotic fluid cells, count cells from 6 to 12 colonies, 1 karyotype, with bending. Any number of methods may be used, including polymerase chain reaction, PCR, restriction fragment length polymorphism, RFLP, and northern or southern blot. Molecular cytogenetics, DNA probe, e.g., fish. Fluorescent in situ hybridization, FISH, is one type of DNA probe. It allows chromosomes and genes to be analyzed simultaneously. In situ hybridization involves treating native double-stranded DNA to render it single-stranded. The strand is incubated to allow the strand to recognize complementary bases and to reform as a double strand, hybridization. When a strand is radioactively marked, it is the probe. The specificity to which the hybridization takes place is analyzed. Molecular cytogenetics, chromosomal in situ hybridization, analyze 3 to 5 cells, e.g., for derivatives and markers. Analyze 10 to 30 cells, e.g., for microdeletions. In situ hybridization is used to determine the consequences of a given genetic alteration on gene expression. When 3 to 5 cells are analyzed usually to identify derivatives and markers. When 10 to 30 cells are analyzed usually for the purpose of identifying microdeletions. Molecular cytogenetics, interphase in situ hybridization, analyze 25 to 99 cells. Analyze 100 to 300 cells. In situ hybridization techniques used during interphase, resting phase, of cell division, for analyzing 25 to 99 cells. When 100 to 300 cells are analyzed, report 88,275. Chromosome analysis, additional karyotypes, each study. Additional specialized banding technique, e.g., NOR, C banding. Additional cells counted, each study. C banding is a method of identifying banding patterns based on nucleic acid content and staining. Chromosome analysis, additional high-resolution study. This code is used for chromosome analysis to detect certain disorders or syndromes that may be inherited. The chromosomes of individuals with suspected genetic anomalies and neoplastic disorders are analyzed to provide definitive diagnosis. In addition, suspected carriers may be analyzed for recessive traits that may affect, or have affected, their offspring. This code is used for each additional high-resolution study. Cytogenetics and molecular cytogenetics, interpretation and report. This code is used to report physician interpretation and report of complex cytogenetic and molecular cytogenetic tests or when abnormal cytogenetic tests require complex interpretations.